Hello everyone, my name is SZumel, and welcome to my presentation for the individual role as a future advanced practice nurse. Today I will be discussing how I envision my career as a future psychiatric mental health nurse practitioner, also known as a PMHNP. My desire for this new role stemmed from my interactions with pediatric patients experiencing a psychiatric emergency. Over the past 7 years, I have witnessed the results of countless pediatric patients not receiving care for underlying trauma and other mental health conditions. Results I've seen are hospitalization of children and adolescents from suicide attempts, suicide ideation, malnutrition due to anorexia nervosa and bulimia, and physical aggression. With the new role as a PMHNP, I hope to bridge the gap in access to quality psychiatric care to the pediatric population. Opportunities for increased access have been found through telehealth. The use of telehealth for psychiatric patients has exploded following the restrictions and subsequent infrastructure that resulted from the 2020 COVID-19 pandemic. Outside of obtaining board certification, I will be more effective in my profession if I obtain additional training. The training I am looking to obtain is training in psychotherapy, as this is an important part of developing a therapeutic relationship with my patients. Behavioral de-escalation is a crucial skill to have. In acute care, patients who arrive into the hospital setting are often at the peak of their crisis. These can manifest themselves as self-injurious behaviors or aggression towards staff. Knowing how to de-escalate patients with these behaviors is vital to caring for them and ensuring their safety. Family counseling is especially important in pediatric psychiatry. The family unit is crucial to the developing mind, and empowering families to manage psychiatric conditions at home is vital for their future mental health. Family counseling via telehealth has also been found to provide comparable results as family therapy, which was conducted in person. This highlights an increased capacity to provide care to more patients. Social factors that could influence the role of a psychiatric mental health nurse practitioner are the lack of knowledge about their existence. There is also still a stigma surrounding mental health, preventing people from seeking help. In a legal sense, PMHNPs do not have full practice authority across all 50 states. And while California has made recent changes to NPs and their practice authority, it will still take a few years for them to obtain that independence. Regarding economics, there still remains health disparities that exist among all healthcare specialties. These include, but not limited to, adequate transportation and sufficient internet connections. Affordability of medications is also a barrier, as not all plans will cover certain psychiatric medications as well as psychotherapy, forcing patients to pay out of pocket. Some global things to consider are that PMHNPs are not recognized outside of America, and it will take some time before this access will be instituted in other countries as well. As a guide for this career, I have chosen Hildegard Peplau. Peplau is known as the mother of psychiatric nursing. She is responsible for developing the framework for the nurse-patient relationships. This framework is known as the theory of interpersonal relations and is divided into 3 phases: orientation, working, and termination. During the orientation phase, the nurse introduces themselves as the patient's resource, surrogate, and advocate. The nurse must be able to actively listen and identify the specific needs of the patient rather than their own needs. The nurse will spend the majority of their time in the working phase. During the working phase, the patient accepts the nurse as their support person and begins to participate in their own care. being an active member in the decision-making process with the nurse acting as their educator and advocate. The final phase, the termination phase, usually begins when the patient is ready for discharge planning. In this phase, the nurse educates their patient about symptom management and how to independently manage their health conditions at home. The beatitude I have chosen to shape a PMH NP's role is from Matthew chapter 5, verse 3. Blessed are the poor in spirit, for theirs is the kingdom of heaven. Some highlights to take away include that spiritual wellness is important for everybody, not just psychiatric patients. A Christian worldview shapes the role for a PMHMP by helping patients find their own spiritual emptiness and how that emptiness can be filled by putting God first at the center of their lives. Here are my references, and this concludes my presentation on my view for my future as an APRN. Thank you for your time.